Thank you so much. Excited to be here and speak on behalf of the Learning Health System Core to describe innovation highlight, specifically evaluating a pilot of the Abridge Ambient AI Scribe technology. So the problem that we were trying to solve in this particular pilot is an issue that we're all very well familiar with, clinician burnout. And when you think about clinician burnout, it's certainly a multifactorial problem, but one of the common denominators is EHR burden, the time it takes clinicians to document within the EHR. One fancy proposed innovation or solution to this problem or to lessen this problem are AI ambient scribes, such as the Abridge tool, which a clinician can simply turn on using their phone when they enter a room or a patient encounter. And it listens in the background as they have a conversation with their patient. When they leave the room with the patient, they have a nice clinical document in the EHR summarizing what they did with the patient. The hope with this particular type of technology is that it decreases clinician time spent and burden with the EHR in documenting. And it also makes them more satisfied with their clinical care because they can truly engage more with the patient and not have the computer between them and the patient as they're furiously trying to get their documentation done. The problem with this, and the reason why we didn't just jump right into it, is because implementing such a technology comes at immense cost, millions of dollars, and there's not clear data to demonstrate it's anything more than hype. So what we did is we partnered with the School of Medicine, Children's Hospital Colorado, and UC Health to do a rigorous pilot evaluation of this technology, specifically the Bridge tool. And while what we did was very similar with Children's and UC Health, I'm going to focus on what we did at UC Health for brevity's sake. So UC Health and Children's had a limited number of very expensive licenses to use, and there was a 6-month duration. Therefore, we planned a 6-month randomized controlled trial with 281 clinicians spanning 43 different primary care and specialty clinics, which began in January of 2025. To ensure sustainability and scalability, if deemed worthwhile at the end of this pilot, we applied implementation science methods and principles guided by the practical, robust implementation and sustainability model to ensure alignment with the health system workflows, clinician needs, priorities. And this all began back in July of 2024. We also made sure that we understood what the outcomes of interest that would inform decision-making were. So we engaged health system leaders and frontline clinicians to understand their needs and what actually would tip them at the end of the pilot to determine yes, go, or no go, stop the pilot, or go. Throughout this process, we identified a number of different outcome measures of interest. Rising to the top were clinician burnout, clinician retention, and time spent in the EHR. We also clearly understood, based on our team, that this needed to be a mixed methods evaluation. What we ended up doing was taking those clinicians and randomizing 137 to control and 144 to the bridge intervention. A very critical part of this particular pilot was the way that we did the randomization. We had to do the randomization in such a way that met operational needs. Health system leadership said, you cannot waste these expensive licenses. So if you randomize someone to a bridge and they don't use it, you can't just let that be. We need to make sure that someone is going to be using it. So critical to this was our waitlist control randomization design. This was essential to making sure that we were able to do a rigorous evaluation. What we found, first and foremost, it was used in the majority, 68% of eligible visits. It also decreased documentation time in the EHR by 18%. Now, 2.2 minutes per appointment may not seem like a lot, but if you extrapolate that to a clinician who's 50% clinical, what that means is 2 hours per week of time spent per that clinician and more than 100 hours per year. Think about a full-time clinician. That's more than 200 hours a year of time spent which is significant. In terms of clinician burnout, what we found is that among those using a bridge, clinician burnout seemed to improve. Those that were not using it, it pretty much stayed consistent. When thinking about clinician retention, the number of clinicians who said that they would consider leaving the institution stayed pretty consistent among those using a bridge. But those not using a bridge, we saw a substantial increase in the number. Now, this is significant because there are large dollar signs attached to clinician retention. On average, replacing a clinician costs between $500,000 and $1 million or more, depending on the clinician. So these were significant findings. Illustrative quote from one of our bridge users that I think is pretty powerful. I was one of those people who was aggressively sprinting towards burnout. And then from day one of a bridge, that just stopped. I actually cried in the office at the end of the day because I was like, oh, it's 5 o'clock. I'm done. So to summarize the impact of this pilot, first and foremost, it led to system-wide expansion at Children's as well as UC Health. It also demonstrates the value of using innovative pragmatic methods to ensure rigorous evaluation, namely, in this case, our waitlist control randomization, among many other things that I'm not able to share because of time limits, to allow these pilots to be done in routine operations in ways that meet operational needs. It also is one instance in which we demonstrate that AI isn't just hype, it is reality. That's the instance here in terms of Ambient AI and the bridge tool at our health systems. It also demonstrates that not only we have strong relationships, but it strengthens the relationships between us and our health systems. It's a good demonstration, in my opinion, of community of we in action, a collaboration between Accords, School of Medicine, UC Health, and Children's Hospital, where many very busy people came together to tackle a very challenging and complex situation in a very short period of time and ultimately benefit clinician experience at our health systems.